Welcome. In this session, what I want to discuss is issues pertaining to HIV and AIDS. And when you talk about HIV and AIDS, this is one of the serious pandemics that has affected the whole world in one or another in terms of productivity, amongst other things. So we want to see different organizations that tend to develop different interventions at the workplace, and what kind of interventions can employers do within the workplace to ensure that they're able to effectively manage issues pertaining to HIV/AIDS. So this could be issues related to how to support the employees, but also how, at the same time, how to ensure that the employees are not discriminated in one way or another. And what we need to appreciate is in Malawi, we are governed by the constitution. We also have the HIV/AIDS and Prevention and Management Act of 2018, and also at the same time we have got the national AIDS policy, which guides Malawi in terms of how to best manage issues related to HIV/AIDS. So that's what is very important for us. And also we have got an institution that is mandated to regulate everything related to HIV/AIDS, and that's the National AIDS Commission, which is also provided by the HIV/AIDS Prevention and Management Act, which empowers it to carry out different functions. So it could be issues related to coordination of the national response related to HIV/AIDS, and also manage and coordinate every government policy that could be there, but also at the same time to provide also technical support to government on how to mitigate issues related to HIV/AIDS. And also whenever there are development of HIV/AIDS policies, then the National AIDS Commission is responsible to ensure that is able to effectively review such kind of policies. So what we need to appreciate is that at the workplace, you can have a policy. For example, how do you manage issues pertaining to HIV/AIDS management at workplace? So you have a policy, and the policy will guide you on how best you can be able to manage issues pertaining to HIV/AIDS. But whenever you are developing the policy, this has to be done in light of the act, and also at the same time the national policy. And also at the same time, you need to have certain mechanisms within the workplace. Maybe how do you manage the HIV interventions at workplace? So you might need to have maybe a workplace committee. At the same time, you might need to have peer educators. These are now to be peers, like groups within the organization. Could be lower employees, upper employees. So as peers, as friends, they can have some representatives who can be able to pass the message whilst they are working. They can be able to share some kind of information to their colleagues pertaining to HIV. So you can have a peer education group, the HIV/AIDS workplace committee, but also at the same time you can have a committee pertaining to people living with HIV within the organization, or this sometimes people would call them the support groups. But at the end of the day, we should be able to appreciate that what is important is for you to have a policy as an organization. So when you have the policy, because the policy is going to guide what kind of interventions can an organization do to fight against HIV/AIDS regarding the transmission, the care, and also the kind of medical support that can be provided to the employees. So it's very important for us to appreciate that, and also at the same time to also to look at to say how do you manage HIV/AIDS effects within the organization. So the policy also will be able to guide to say how do you manage the effects of HIV/AIDS within the workplace. Could be some illnesses, could be absenteeism, or even death. Yeah, but also at the same time, how do these things impact on the productivity of the organization, and also how do it supports the motivation and also the morale of the employees. So we should be able to know that, and also the policy would be able to guide the employees on some of the issues they are ignorant about, because HIV/AIDS management is also a big problem, because of the ignorance and also stigma associated with the management of the HIV/AIDS. So it's also important for us to appreciate, to say how best can we be able to manage in light of the ignorance that maybe employees might show within the workplace. So we should also be able to appreciate, to say whenever you have got a policy, for example, it's always important that the scope shouldn't just be limited to the employees, but also should also go beyond the employees. So could be the other people who are outside the organization. Could be, I'll give you an example, at an organization, it's not just the employees, could be the outsourced service providers. Outsourced service providers could be the guards, the cleaners, the landscapers, amongst the catering staff members who might not be the direct employees of your organization, but you should be able to reach out with the messages, because there is always interaction between, maybe sexual interaction between your employees, but also these other employees. Also, you can also have a situation whereby others could be working in projects, for example. So those people who are working in projects could also be supported in one way or another with the HIV/AIDS messages and also interventions, and also could have a situation maybe could be suppliers supplying, or customers. So you should also be able to reach out to customers, because through the interaction that your employees might have with the customers, the clients, you might find that there's also sexual interaction, which in one way or another, both sides can contract HIV and AIDS in one way or another. But also what you need to appreciate is whenever you are developing your HIV/AIDS policy, you should look at issues of confidentiality, issues of equity, to treat everyone equal, and also issues of rights. People have got rights, like rights to disclose some information. Maybe, the employees have got their own privilege to know they are healthy, but not you have to communicate anyhow to anybody. But also, how do you support in terms of psychosocial and also support we can be able to provide, and also issues of gender equality tend to come in when you're managing issues of, but also there should be commitment from the leadership of the organization, which is also very, very important. So what we need to appreciate is also, whenever you are developing this kind of policy, for example, we should also be looking at, as I said, the policy should speak to the national policy of the country, but also at the same time, you should also be able to speak to the HIV/AIDS Act, which we have in Malawi, for example, but also at the same time, the Public Health Act, and also including the Constitution. These are some of the policy documents which should be able to guide you to develop the HIV/AIDS Management Act. The HIV/AIDS policy at the organization, which is very, very important, because at the end of the day, you should be able to look at, to say, how are we managing our employees, what kind of intervention should we put, and you should be able to accept, to say, the interventions that you need to put forward within the organization should be those that are acceptable by the Malawi government. So they can only be acceptable if they are in line with the Act and also the national policy. So, for example, you can have a mechanism of how maybe you can be able to distribute maybe condoms to staff members, and also maybe avoid the discrimination, and also at the same time, how do we prevent the spread of HIV/AIDS amongst the employees, for their families, and also amongst customers. But also at the same time, there is also an issue of maybe serostatus. People talk about serostatus, to say maybe an employee has to know how whether is positive or is negative. So it's very, very, very important. So serostatus is just a matter of you knowing whether you are positive or you are negative. It's very, very, very important. What kind of interventions are you going to include whenever you are looking at the issues of HIV/AIDS management at the workplace, to ensure each and every employee is aware of his or her status? So what kind of mechanism could be self-testing and all that? So I think one of the things that also we should be able to appreciate is that within your policy, you can have to say, maybe, how do you promote issues of non-discrimination, in terms of recruitment, so that people who those who are infected by the virus and by the virus are not discriminated when it comes to recruitment, training, promotions, amongst other HR decisions, which could be their transfers. And also at the same time, we should promote HIV testing services, and also at the same time, we should be ensured there is confidentiality of HIV status of employees. And also at the same time, we should also be able to provide some kind of nutrition support for your employees. So the policy should be able to guide to say what kind of nutrition support can you be able to provide. And also at the same time, if it's medical treatment, what kind of medical treatment are you going to provide? But also at the same time, we should also look at the how do you achieve the 95, 95, 95 within the policy. So within the 95, 95, 95, the policy, the government policy says to say 95% of the people have to know their HIV status, and also 95% of the people have access to treatment, and also at the same time 95% who are on treatment should have their viral already suppressed. Yeah, suppressed meaning to say the viral load has to go down to an extent that the HIV is even has reached the level of undetectable. And now, let me emphasize here with this kind of, we should also know that when someone has consistently taken ARVs, when one is positive and has consistently taken ARVs, you might find his viral load would go down to an extent that if you do simple tests like antibody test, you might not be able to detect the HIV, the antibodies, because the antibody test, that one we just prick a finger and put blood on a gadget. That one we call it the antibody test. They go for whether in our blood there is antibodies for HIV. We all know that whenever we have got infections, there are antibodies which tend to fight the virus. So you might find that to say when you are using that one, you might not have the it might come negative just because your viral has suppressed to undetectable levels. But if you go for other tests, maybe DNA test, you might be still found to be negative. This is where now a lot of people, when they have been preyed upon by maybe pastors and whatever, they can be able to say, no, I went to the hospital and I was declared to be negative. No, it's not you are negative. It's just because there was the tool that you had used for the testing was not enough to detect the virus itself, but maybe it was looking for antibodies. So for the antibody test, you can test negative, whilst you can go for DNA test, you might still be found to be positive. But when you have reached that level where your HIV viral load has gone down to that extent, you should be thankful, and you should make sure that that kind of condition should continue, because it means even these opportunistic infections might not be able to affect you in some way. So that's what we should be able to appreciate. And also at the same time, there's also a need for us also to look at issues of first aid, to say maybe how do we support each other whenever there are accidents and all that, how maybe people are injured, so that people are not able to pass on the HIV to their friends and all that. So issues of first aid, but also whenever there is blood exposure, as I was saying, the first aid, to say when there's blood exposure, how do you manage that to ensure that there's a safety after blood exposure. But also HIV's information, you should also be able to share correct information. Issues of PEP could be in the policy, for example, to say post-exposure prophylaxis. This is a drug which you take after you have been exposed to HIV, but it has to be taken within 7 hours. When you feel that you have been exposed to HIV, you have to take it within 72 hours. And PrEP also is another important drug which you can also be taking before you want to go, maybe you want to go into a sexual intercourse with someone. You can take PrEP as a protection for you not to get the virus. And also there are so many things that should be able to appreciate. I think in terms of transmission, to say how do you protect your employees to ensure that they are not at the risk of transmitting or acquiring HIV/AIDS. Yeah, so what is important for us, I think we should also be able in our policy to say what kind of intervention can the employer put in place to ensure that there is appropriate training and also protective equipment to ensure that there is a reduction in the risk of spread of the virus. And also at the same time, if, for example, the exposure has happened under Section 31 of the HIV/AIDS Act, it encourages the need for us to have the post-exposure prophylaxis. So this is also some of the things which are very, very important, and also to provide the counseling, which is also very, very important. And also, I think one of the things that we should also be able to appreciate within the HIV as a space is also to have, as an organization, HTC services where people can be able to do self-testing, maybe also can have access to testing and counseling, and but also we can be able to use some interventions could be condoms, provision of condoms. You can encourage your employees to go for male circumcision, but also you can encourage use of elimination of mother-to-child transmission, but also provide the nutritional support, which I had said earlier on. These are some of the important things that should also be looking at to saying employees are aware of these things, and how are they, what are the advantages and also disadvantages of each and every service that we are offering to the employees at the workplace. And also at the same time, the awareness campaigns, you should be able to share knowledge and also information pertaining to issues of HIV/AIDS. But also, you should also have, if you have got a clinic within the organization, you can have ART. This is whereby you antiretroviral therapy, whereby you can be able to provide medication to those who are affected by the virus. So you can encourage them to access this kind of therapy from other service providers, health service providers. But also you can have some kind of an arrangement as an organization, as a policy issue, to say we can be able to have learning visits to other organizations to say how are they managing HIV/AIDS interventions, and also how do you bring those interventions to the group at the organization. And also I think you should also have empower the committee. You should also be able to train the committees, which could be, this could be the peer educators, the supporting groups, the occupational safety and health. Because others have said maybe we shouldn't mention that we should have HIV/AIDS committee, but maybe we should have an occupational safety health committee, and also you can also have a deliberate mechanism within your policy to state that maybe you need to have HIV/AIDS events. So you should be taking part in the HIV/AIDS, like in Malawi, we always have 1st December as our HIV/AIDS day. So you should be able to allow your employees to attend such kind of an event. But also at the same time, what is also important for us to appreciate is that we should be able to encourage employees to have access to different information, and also at the same time ensure that the information is up to date and is accurate. Because there's certain information which are also not accurate, and like there could be issues pertaining to some methods to say no, this kind of methods that don't transmit HIV/AIDS, or maybe you can become negative if you're positive if you take this kind of fruits and all that. So this is also very, very important. And also at the same time, I think the HIV/AIDS Management Act provides for accreditation of information. So all information that you are developing within the organization, so this kind of information can be in your policy to say all information that you are developing within the organization should be accredited. So should be accredited by NAC. That's very, very important. The National Health Commission can accredit your information. So when you have developed materials on HIV/AIDS, you can be able to share, whether it's a newsletter, whether it's messages and all that. Maybe you can have messages on your pay slips. If you are a retail company, for example, you can have them on bills and all that. Invoices, you can put HIV/AIDS messages. On quotations, you can put HIV/AIDS messages. So, but make sure the message that you are putting on that kind of documentation is properly like approved or accredited by the organization, by the National Health Commission. That's very, very important. But also I think you should also, in your policy, you can have a budget, for example, to say how much are you going to contribute as a budget to the HIV/AIDS activities, and also at the same time, and how do we ensure that the stakeholders are knowledgeable of the policy at hand. So that's very, very important. You might need also to have a coordinator for so the police will also provide for having a coordinator who is aware of the HIV/AIDS issues, and also maybe to coordinate all activities pertaining to the HIV/AIDS activities. Yeah, so these are some of the important things that also are very, very important, and also they have to make sure that they understand this kind of issues, which is going to help them in one way or another. So there's some of the important things which are very, very important for us to. But also another thing that we should be able to appreciate is to look at some of the harmful practices that can happen within the organization. There are certain harmful practices that can happen within the organization. I'll give you an example. We talk about issues like Fisi, Chijuma, Mpinga, like Loa Kufa, and also among other things, yeah, and also Kondragua, Guamula, among other things. These are things which are perpetrating. So you can also be able to educate your employees, because as I said earlier on, they could be knowledgeable, but they're also having the other family members who are not knowledgeable. So how are these contributing to the spread of HIV/AIDS? So the HIV/AIDS Management Act under Section 2 provides that it's an offense for one to indulge in all these activities, and one can be imprisoned for a number of years. And also at the same time, what is important, as I said earlier on, issues of discrimination. It's not good to discriminate someone because of his HIV status or HIV status. So we're talking about issues pertaining to recruitment, training, promotion, among other things. And also people have to have rights, and also already within the Constitution, under Part 4 of the American Constitution, there are issues of human rights. So people living with HIV/AIDS should not be deprived of their rights. So you can have a section within your policy on how you are going to manage or to protect the human rights of individuals working within the organization. But also at the same time, in the event that maybe if someone is being deprived of enjoying his rights because of his HIV status, yeah, then that person, the one who is propagating that, could be punished by the act. And also I think there is a fine of about 5 million kwacha, and also at the same time you can also be able to serve a period of 5 years in imprisonment. But if you're an institution, you can be able to serve for a period of 10 million. So you can have this kind of things, information in your policy. And also I think another thing also we should be able to appreciate, I think, is also to say, when one is infected with HIV, but it is true, it is found out that the employer did not provide some kind of proper tools or protection for the employees. That's why the employee has been infected. This employee would be compensated under the Workers' Compensation Act, and this is under Section 33 of the HIV/AIDS and Management Act. So whenever employer is found to be negligible, because it has led to, maybe, for example, I'll give an example, a nurse is working but has no gloves and is being forced. Of course, we know to stay away from the workplace is also, but maybe this is a critical issue. He doesn't have gloves, and there's a patient who has just come from an accident scene, for example, and blood is just oozing out. So he's trying to help this particular patient and or injured person. You might find that maybe in the process has contracted HIV/AIDS, and you might find this employer would be liable, and he will be having issues pertaining to a fine and also imprisonment of the employer. So these are not some of the things that should also be able to appreciate when it comes to issues pertaining to compensation. So we should also be mindful of the fact to say every employee has the right to not to disclose or to disclose his HIV status. So nobody is supposed to, maybe the HR Yeah, I think we should can have it that this kind of section in our policy to say the only person who can be able to share information about his or her HIV status is the employee himself and not nobody else. And anyone who is found to be disclosing would be it's a fine, and also could pay a fine, and also may be arrested. And also these are some of the things that we should be able to appreciate. And also I think what we also be able to appreciate is that within our policy we can have a situation whereby maybe which activities tend to promote or maybe a risk at contracting HIV. So you are talking about the transfusion of blood, maybe transplant of organs, and also during labor or during pregnancy, but also whenever there are sexual activities. Yeah, so these are some of the things. And also you can provide the different HIV testing mechanisms which could be there and all that. These are some of the important information you can be able to, but also you should be able to ask your employees to say within the policy to say HIV/AIDS, there's nothing like compulsory. It's not, HIV/AIDS is voluntary. So anyone who forces someone is also an offense within the. So if you force someone to disclose each HIV status because of a job or anyhow, then you are subjected to a fine and also imprisonment. And also I mentioned of the need for you to accredit information, to say whenever you want to have any information pertaining to your organization or NHIVs, you have to accredit such kind of information as to be sent to NACI for accreditation. This is empowered under Section 24 of the HIV/AIDS Management Act. So these are some of the things which we should be able to appreciate and also know within the workplace. So I think I can be here talking a lot of things, but I think what is important for us to appreciate that as an organization, we need to have an HIV/AIDS Management Act, and the policy. And the policy should have the mechanisms of how you're going to deal with all the processes pertaining to HIV/AIDS management, issues of testing, issues of confidentiality, issues of harmful practices, issues of support to employees who have been affected by the virus, and amongst other things. So if you want to develop a policy, for example, on HIV/AIDS, you can engage change consult group and be able to support you in one or another. Just like any other policy that you may want to have, you can be able to engage change consult group and they will be able to support you to development of the policy, and so that you have a policy that is in line with the Act of Malawi, and also at the same time the national policy of Malawi, so that we are able to mitigate issues related to HIV within your organization in a very professional manner. Thank you so much for watching.